There is no such thing as a medically necessary abortion, ever. They're just being told it's just a suffering for that child, and so you should instead terminate it. Acting like termination or an abortion is the kind and loving thing to do rather than the barbaric thing to do. Pulling a child apart piece by piece is definitely not kind and loving. There's no kindness or lovingness associated with that in reality.
Dr. Monique Ruberu, thanks for sitting down. Let's hear a little bit about your background.
So I was allopathically trained as a traditional doctor, and then I opted to go into OBGYN, did my medical residency. And following my residency, I practiced like a typical gynecologist for a few years. And then at the same time, my marriage was kind of, after 10 years of marriage, our marriage was on the brink of divorce. 2 beautiful children, one growing in my belly. And that marriage breaking down was the opportunity that God used to completely change my life. And after he healed my marriage, I decided that I needed to do something very big for him. And for me, that very big thing, which I had never done in my life, was praying outside of an abortion center. And when I went that day to pray outside of that abortion center, I had no idea, but the patriarch of the pro-life community in Philadelphia, who had started pregnancy maternity homes, he had started the pro-life union, he had done all of this stuff. He had gone every day to mass and prayed that a pro-life OBGYN would come to Philadelphia to start a women's healthcare center to offer true healthcare to women. And when I showed up on that day, he had died the night before. And his children showed up in his place. And so I had watched Abby Johnson's Unplanned, and that had laid the seeds in my heart that you could be compassionate and loving and caring to these women outside. So I'm showing up for the first time not knowing if I'm going to get arrested or what's going to happen and scared to death. But just standing on the sidewalk praying wasn't enough. I felt like I needed to do something more. So I started reaching out to the women and telling them I was an OBGYN physician and is there anything I can do to help you? And one of the women actually chose life that day. And everybody was celebrating because they realized how important that one life was, how many lives would come from that life. It was so beautiful. And so this gentleman came up to me and he was like, "Who are you? And what do you do?" And I said, "I'm a pro-life OBGYN. I had never before called myself a pro-life OBGYN, but that just happened to be the phrase that I used. And he was like, "My pop sent you." And I was like, "I don't know your pop." And then later I find out that this man had been praying for a pro-life OBGYN to show up, and I just happened to say that. But that gentleman, his eldest son, Patrick Stanton, dropped off a book about NAPRO technology to my office the next day. And when I opened that book and I started reading about all the ways that we could address every GYN issue without the use of contraceptives, that we could address infertility without the use of IVF, I was blown away. And I opened the drug cupboard and I started reading all of the package inserts of all of the contraceptive pills. And I was like, oh my gosh, every single one of these has a mechanism of action that actually acts as an abortifacient, thinning the inner lining of the uterus and possibly preventing an embryo from implanting at the very earliest stage of life. And so then I realized that I needed to practice this kind of medicine. So I went and I spoke to administration and I asked them to send me for training. Go to find out that that same man who had been praying all that time had spent the years prior badgering my hospital, asking them to get somebody to do this kind of medicine. So the textbook for NAPRO technology was sitting 8 feet away from me in my office manager's office for an entire year. And I had no idea because they were trying to convince another person in my office to do it. Ultimately, that's what led to me starting to practice in this way. And there was a lot of other kind of persecution along the way after that, but so worthwhile to be able to practice medicine in such a way where I'm not covering up anything. I'm not placing a Band-Aid on top of problems and trying to hide them, but actually looking for the root cause of those issues and addressing the root cause and helping women to heal so that they're not ending up with infertility down the road. Or if they're already in that state, helping them to understand why and being able to help them to address those issues and hopefully improve their fertility, protecting pregnancies along the way.
There's so much of your story that is so beautiful. And I know people listening, I know we have people who listen sometimes who are pre-med or they are in the medical field and they are struggling because they have this pro-life ethic and then they see the challenges about practicing holistic pro-life medicine. And then there's a lot of debate about what that even looks like. So there's so many things I want to break down, but before getting into that, I do want to ask you about that first time at the abortion clinic, because that takes a lot of conviction to go show up at an abortion clinic when you've never done that before. And, you know, my challenge is to anyone listening that everyone do that, even just to pray for 30 minutes, even just to go out there and, you know, whatever your belief system is, just to offer prayers and be a witness to life, because it changes someone to actually be at the clinic, to see people going in, add that, and 2 people with every woman going in that's there for an abortion, and that one life will be ended there that day. I think it's hard to even wrap one's mind around the gravity of that. What inspired you to go to the clinic, first of all? That's the first question. What inspired you to even go?
When I read Abby Johnson's book, Unplanned, prior to that, I had gone to an amazing Catholic school. I had seen people going out to abortion centers. Myself, I was really poorly educated when it came to abortion, despite the fact that I was, you know, heading towards medical school and all of that stuff. When I really began to understand that, number one, abortion is not something that I can make a decision for myself and I can just let everybody else think or do whatever they want because that's their own choice. It's not that they are making a choice just about their own body, but is another individual that nobody is speaking for. When I began to realize that victims of rape, babies that are conceived in rape and through incest, that their lives are equally important as anybody else's lives, that when a man commits a rape against a woman, he is not dismembered because he did that, but the innocent child is dismembered. When I began to realize all of those things, and then I read the book, which helped me to understand that there is a way to show up for these people other than standing outside of an abortion center and yelling at them or condemning them. I refused to go when I was in university because in my mind, I had this image that people were standing outside and just screaming at these women. But when I realized how it was done beautifully, compassionately, lovingly, then I realized that was something that I wanted to be a part of. There was absolutely the fear factor because I had never done this before. And on top of everything, that day happened to be a blizzard. So I'm standing outside, couldn't feel my cheeks, tears pouring down my cheeks because I'm seeing 30 plus cars coming towards this abortion center. And I'm like, when is this going to end? All these innocent lives are just going to be slaughtered today. And that one baby was saved, but there were another 29 that ended up in the trash. It was the hardest thing that I had ever done. It was emotionally just exhausting. And I honestly, on that day, I hoped that it was like enough, that I wouldn't ever have to do it again. But once you've done it and you've realized the importance of being there, that it's not just you showing up. You could show up and not say a word because it's a spiritual warfare. There's so much more than us just showing up and actually being able to hand someone a pamphlet or speak words to someone. This is a battle of principalities. There are demons at play here who are convincing people that it's okay to end the lives of innocent human beings and to harm women in this way. That is not something that anybody with any sense of faith or love and joy can easily accomplish without feeling some sort of unrest. So there's got to be another realm to this. And when you show up and you're willing to stand there on the battlefield and you're willing to just pray and ask God to send guardian angels to turn the hearts and the minds of those who are working within there, turn the hearts of the minds of those women, to give them the courage to step out of that place, it's life-changing. There is a peace that you feel when you're praying outside of an abortion center that makes no sense whatsoever. But I truly believe that it's in those moments when you're in the midst of battle that graces are given unto you, that you have the ability to stand there and participate in that fight. And I think that's what's kept me going back over and over. There's not, unless I'm far away from an abortion center and can't get to one every Saturday, I will show up outside of an abortion center and I will pray, just because I feel like the ability to participate in that battle is so important. With everything that has been done for us, that's a small sacrifice in comparison.
How many years have you been doing that now, Doctor?
I would say since my reversion at the time that my marriage was healed. So now about 11 years.
Wow. And your practice has changed in a big way since that miracle in your marriage and you call it your reversion. I want to break down what that looks like, because again, I think there's this misconception among people that think pro-lifers, or they hear about kind of alternative ways of medicine, and they think it's kind of not really scientific, it's kind of kooky, and of course the best way to do it is what ACOG is saying: birth control, IVF, abortion, of course, this is the standard way, contraception, everything else. But there's an alternate, not just an alternate view, but there's a truth about the way the body works and about the research out there that actually shows the health that this alternate way brings people to. True health, the lasting health. I've talked to other doctors. One of my good friends is Dr. Lila Rose, who you guys are both awesome, but she had this similar journey where she had this transformation and she thought, I have to practice real medicine now. This is real medicine, to do real fertility treatments and real GYN care. So I'd love to hear you unpack. Maybe let's start with, I know there's a lot of directions this can go, but let's start with contraception. That's, of course, one of the more controversial ones. And a lot of people today believe that contraception, especially if it's used responsibly and you have full knowledge of the risks, it's necessary for women's healthcare. Why is contraception not necessary for women's healthcare? And the first part of that I'd love to hear you comment on is not just contraception used as contraception, but birth control, it's used to treat other conditions as well.
Absolutely. So when I was going through residency in OBGYN, we were informed basically that every medical problem, pretty much, except the ones where we use surgery to cut something out, should be addressed with contraceptives. So if you have abnormal bleeding, use a contraceptive to shut down the bleeding. If you have irregular cycles, use a contraceptive to get your cycles on the right path. If you have PMS, you should use contraceptives to shut down your hormones. It's the most boring way to practice medicine. There's no ingenuity, there's no creativity, there's no exploration or spending the time to actually look deeply into a woman's health to understand why she's having this issue to start off with.
Why is that? How did we get to the point where birth control is just handed out as the solution to all of these conditions or problems?
I think it has a lot to do with the pharmaceutical industry and their ties with the medical education. And initially they were pouring a lot of money into the medical system, and they would, wine and dine doctors and whatnot. Now a lot of that has been stopped, but there's been this ingraining, this teaching of this is how it's done, this is how it's done, this is how it's done. So you should just do things the way that it's always been done. And I don't think, back in the day before contraceptives were a thing, I don't think doctors practiced that way at that point. It was after these things were produced and they started giving out the easy and quick solution. A lot of people aren't interested in doing the work. If they have the option of doing the work, taking care of your body, eating the right foods, exercising, cleansing your body versus taking a pill, there's a large segment of our population that would rather just take the easy way out and take a pill. Insurance companies want physicians to see at least 30 plus patients a day. Most doctors don't have the time to sit and actually get a really good history from a patient to really understand what their bleeding pattern is like, to be able to explain to them what is normal and what is abnormal. Most gynecologists haven't been taught that themselves. What is a true normal bleeding pattern? How long should a cycle be?
That's crazy. Most gynecologists don't understand the proper or the health model for what is a completely
normal cycle.
That just sounds incredibly crazy to me. But it doesn't surprise me because most girls are not taught about their fertility anyways.
Exactly. So I would say when I learned about NAPR technology, that cracked the door open so that I was able to actually look outside of everything that I had been taught in allopathic medicine that said that for all these problems, your only option is contraception. Because now I knew there was another option. And NAPR technology, for all of your viewers who have no idea what it's about, or natural family planning methods or fertility awareness-based methods, it's based on the idea of actually just paying attention to the language your body is speaking to you. So every day when you go to the bathroom and you wipe yourself, you just make quick 3-second observations. Am I bleeding? Am I not bleeding? If I'm bleeding, what does that blood look like when I wipe myself? Is it very heavy bleeding? Am I soaking through a pad in like 1 to 3 hours? Or is it heavy bleeding? I'm soaking through a pad in 4 to 7 hours. Is it moderate bleeding, 8 to 12 hours? Is it light bleeding, 13 to 16 hours? Or is it just spotting? And if it's spotting, is it brown or is it red? Every bit of that information tells you something. So if you're having very heavy bleeding and you're filling a pad in 1 to 3 hours or a regular tampon in 1 to 3 hours, that is an indication that there's something wrong, that you may have estrogen that's very high that's causing you to have a thickened lining or fibroids or polyps. Those same people are at risk for endometriosis. All of those things are medical problems that cause abnormalities. When you have crazy high estrogen, it pushes down your progesterone levels. If your progesterone level is low, you're going to have more tail and brown bleeding. You're going to have more PMS symptoms. You're going to have more issues with preterm deliveries. So all of this, every single sign that you get means something. Then when does the mucus start showing up? If you have mucus all the way through your cycle, that's another sign of crazy high estrogen levels. If you just have a tiny bit of mucus, that means you don't have enough estrogen to make mucus, and mucus is the highway for the sperm. If you have long cycles that from the first year period to the first year next period is more than 30 days, I always get a little bit concerned about the possibility of polycystic ovarian syndrome or thyroid dysfunction. If you have really short cycles that are less than 27 days, then I get concerned about lower levels of progesterone. So these are all like the little tips that you can, just by paying attention to your bleeding patterns, to your mucus patterns, to the length of your cycle, that you can actually understand if your cycle is normal or not. Most women think that their cycle is normal just because they're bleeding the same way their mother has bled, or their sister has bled, or their friend is bleeding. They're like, no, everybody in my family hemorrhages. That's normal for us. Like, no, it's like in this world, everyone's like, well, there's my truth and there's your truth. No, there's one truth, and now you're varying from the truth. Same way with anything. So there's one normal amount of bleeding you're supposed to have. There's one normal length of cycle. There's no normal for you and normal for me. And if it varies from that, there's a reason for it. So looking for that reason will save you a lot of heartache down the road. Most people think PMS is a normal thing. PMS is not a normal thing.
That's quite the statement.
Yeah. It's a sign of lower levels of hormones or hormonal abnormalities.
Meaning if there's a lot of anxiety, waking,
right before you're
bloating, pain, cramps, you're saying that's not normal.
Not normal. Periods are not meant to be painful.
Wow.
You're not supposed to have pain during the time of ovulation. You're not supposed to have severe pain during the time of your periods.
If someone's experiencing severe pain or a lot of the PMS symptoms, what is that?
So if somebody has severe pain during their period and during the time of ovulation, I always think of endometriosis. Endometriosis is always caused by crazy high estrogen levels. Crazy high estrogen levels are typically caused because people are not able to cleanse out the estrogen that they have consumed in their body. So it's all about gut health and trying to make sure that you have really normal bowel movements to get the toxins out of your body. Most people are drinking coffee like multiple times a day.
How is that not good?
And I'm sorry, Lila, but caffeine acts as a diuretic. It makes you lose your water and then you end up dehydrated. So when you're
to a health session.
Yeah, when you're dehydrated, like you suck back all your toxins. So, I mean, all of these things, when I sort of understand that there was so much that you could do for a person, it makes so much more sense when you look at how the body functions. Like the physiology that we learned in medical school, that makes sense, right? And then when you apply that physiology to all the things that you can do, it's good medicine. And so looking for the root cause always pays off. But now in my office, I don't write for contraceptives. I have people chart their cycles and pay attention to what's going on. Once you know when somebody's ovulating, then you can check hormones at the correct time so that you can actually identify if there's a hormonal dysfunction or not. But otherwise, if someone says, hey, you should just check hormones on day 21 of the cycle, it means nothing. Because you might be ovulating on day 14 or you might be ovulating on day 22. And that's a completely different result. So
what kind of success stories have you seen from patients? I want to talk about fertility in a minute. I know this is all underlying to prepare yourself to be fertile and to have successful achievement of pregnancy if that's what someone's desiring. But just for the other conditions, the heavy periods, or they have, cystic acne, or they have any number of conditions that today often birth control is used as a treatment. What kind of success stories have you seen in your office to treat some of these conditions or symptoms successfully without using contraceptives?
Oh my gosh, like every single one of these issues can be radically changed without the use of contraceptives. The contraceptives, when you use them over time, they actually worsen the situation because your body's fighting against them. Your body creates then estrogen dominance. When they get off of these birth control pills, they're left with that estrogen dominance. So for polycystic ovarian syndrome, there are oftentimes women with severe cases where they're not having ovulation for months on end. And so we can give them progesterone at the correct time in the second half of the cycle to send back signals to the brain to push forth ovulation to help them to cycle, where ultimately they're cycling on their own. There are supplements that they can use to try and help improve their ovulation. There are dietary changes that they can make in order to improve the situation. With endometriosis or any of the estrogen dominance issues, we can have people cleanse their gut in lots of different ways, and that allows them to get rid of this excess estrogen. Changing their diet, doing all of these things helps them to lower that estrogen burden so their body can actually function well. And that reduces the symptoms. And there's lots of different supplements and stuff that you can use as well to address endometriosis. And then NAPRA technology has a method of doing surgical intervention where they're not burning the endometriosis, but rather removing it. So that really helps to lower that endometriosis burden if it's already present. But it's really important, even after that's done, to go in and make sure that you are changing the things that you're eating, changing the amount of water that you're drinking, changing all of these things, improving your gut function so that you don't build up estrogen dominance again. which will cause the same problems over and over.
Is part of the estrogen dominance in part, you mentioned diet and gut health, but I know I was interviewing a gentleman who does research into the estrogen load in our water that we consume through food, obviously the impact of things like pesticides, and how there are record low levels of testosterone and high levels of estrogen in both men and women need testosterone too to some degree, and they're struggling to have it. So do you see a link there in terms of its effect on periods and fertility?
Yeah. So most people assume that they'll identify estrogen dominance, but they'll be told, oh, you're just an estrogen maker. And that's not the case. Most women are getting estrogen from the plastic water bottles, the microplastics in there, the chemicals that are in their shampoos, conditioners, body washes, their makeup. Those are all xenoestrogens, and those things convert to an estrogen effect in your body. But
how big of an effect is that, would you say?
It's a significant effect. However, it all depends on how your body's functioning. Like, if you're someone who's drinking lots of water, not drinking caffeine, you're able to have really good bowel movements, you're able to cleanse your body in that way, then your liver doesn't get overly burdened, and your liver can actually deal with the toxicity that you're being exposed to package it up, get it into your gut, get it out of your system. But if you're someone who is chronically dehydrated and all your body does is it continues to suck back water from your gut to try and maintain at least enough water in your system, you don't have a chance of eliminating all of these toxins, and they just build up and build up and build up and build up in your system. And there's a real lack of information for patients about the importance of just gut health, the importance of drinking water, the importance of maintaining hydration. So little things like that are hugely impactful.
We could talk about this all day. We should do a session, but use it as an education about what this would look like to actually properly evaluate a woman's health and her fertility. But I wanted to talk about the abortion pill as well, because the abortion pill reversal is highly controversial among pro-aborts, of course, those in the pro-abortion world who say that trying to treat or intervene and interrupt the abortion pill regimen, where you have taken already the first pill, you haven't taken the second, and you use progesterone to counteract the impact of the first pill. They say this is, not real medicine. You have actually promoted abortion pill reversal successfully. There's successful cases I'm sure you could tell us about. I think we're at nearly 3,000 successful cases documented nationally. The number might be higher now. What's your take on abortion pill reversal and why it's effective?
Okay, so Lila, if somebody takes poison and they call poison control, don't they offer information on how to reverse the poison? So with the abortion pill, basically the RU486 pill is just blocking progesterone to the baby. The RU486 doesn't cause any genetic anomalies for the baby. It doesn't destroy the baby in any way other than cutting off its progesterone supply.
And why does the baby need progesterone?
Progesterone is the life-sustaining hormone that every baby needs in order to grow. When moms have low progesterone, they end up miscarrying. So a mom that has recurrent miscarriage, one of the reasons that may be is a lack of progesterone. We see that when we check those moms' progesterone levels and give them progesterone, I've had multiple moms that have lost 4 babies, 5 babies, and we check their progesterone levels. We support their progesterone through the pregnancy, and they're having full-term deliveries. So in the same way that I would treat someone in my office who has a history of low progesterone, and I would monitor their progesterone week by week, and I would look at the normal chart for progesterone and compare their numbers and supplement accordingly to raise their levels up. In the same light, I find a mom who has taken the abortion pill. She now wants to reverse it. Nobody's forcing her. The option is to take progesterone to make sure that baby has an abundance of progesterone available to it. And then When the body has cleansed out the RU486, we continue to monitor that mom's progesterone levels and make sure that baby has adequate progesterone. And time again, we have seen babies who have survived this.
Have you seen that?
Absolutely. I have pictures on my wall in my office of babies that we've reversed. Or I have pictures on my phone of babies that we've reversed. They're beautiful. And those moms are so grateful.
There's a gentleman, Dr. Daniel Grossman. I don't know if you've heard of him, but he's a California MD, but I think he works with the university system in San Francisco, but he's very pro-abort. I think he's a fellow at Guttmacher Institute. And he says this is all nonsense. Abortion pill reversal is a lie. And in fact, some tech companies are saying that this is medical misinformation to provide information even about abortion pill reversal. And it's certainly medical malpractice to tell a patient that you can help reverse the effects of RE46 with progesterone.
No, they're wrong. I mean,
why do you think they're doing that? Why are they saying that?
I wish I knew, honestly. I mean, obviously they're trying to push forward the abortion agenda and they don't want anything to stand in the way of that. And there's a lot of misinformation that's given to women, like the idea of if you're having an ectopic pregnancy and you get that medically treated that you're having an abortion, or that...
Tell us about that. Why is that not the case? Why is that not an abortion?
There's a removal of an ectopic pregnancy has never been considered as an abortion. It's always been just removal of an ectopic pregnancy. This is not an intentional killing of the child that is living within that tube. This is removing that child to save the life of the mother, but the intent is not to kill that child. And that is very different. Like there are people who say that if you have a miscarriage and you have a DNC, that's an abortion. I'm like, no, that's not an abortion. That baby is already dead. And we are just helping the mom to expel the pregnancy. So all sorts of things are said in order to push forward this abortion agenda, which are completely wrong. And I feel like it's just to sway the masses and to have good talking points that will bring more people to their side. But it's not true. I mean, if it doesn't make sense medically, if you can help to sustain a pregnancy with progesterone, it's not like we're giving something else. It's not like we're treating in any other way. We're just supporting a pregnancy of a mom that's at risk.
I think that's such an important point because progesterone has been used successfully. I think is it white labeled for the use of treatment for low progesterone levels, right?
Yes, I mean,
progesterone, you take more progesterone.
Exactly.
And that's all that abortion pill reversal is. It's an FDA approved product.
For low progesterone, yeah.
And it's being used to treat. You mentioned some of the misinformation that's being spread by the pro-abortion side. That's what we see all day long at Live Action. It's nauseating and frustrating because there's so many of these viral stories that take off online, and there's, heartbreaking usually, I was very sick and I needed the abortion, or I had a miscarriage and I needed an abortion. Like you said, it's impossible to have an abortion, the direct and intentional killing of a baby when the baby's already passed. But because it's medically coded the same sometimes, they can be told if they had the DNC procedure, oh, I had an abortion procedure.
Yeah.
Do you think we should change our medical coding?
I think that would be very helpful. But the thing is, people need to understand the word abortion in and of itself is not referring to like termination of pregnancy. It's spontaneous abortion means the same thing as miscarriage. So if somebody miscarries, that is a spontaneous loss of life. It's a spontaneous ending of the pregnancy.
A natural
passing of that baby. Threatened abortion means somebody who is at risk of a miscarriage. They're bleeding, their cervix might be open a little bit. So it's a pregnancy which is threatened. It's a possible loss of life. Elective abortion is the abortion we think of, or termination of pregnancy. So yeah, it would be super helpful, especially for all the moms who would rather die than have an abortion. When they come home from a miscarriage and on their billing it says abortion, they get very upset. So it would be great if they could change the terminology. That would be wonderful. and just keep abortion as what abortion actually is: termination of pregnancy or elective abortion.
There is a lot of misinformation, I think, around medically necessary abortions. And I'm not talking about removing a baby after he or she has passed. I'm not talking about the removal of an ectopic pregnancy. I'm talking about something that truly is an elective abortion, but then it's coded as a medically necessary abortion. And there is an intentional and direct killing of the baby because the baby has a disability, a life-threatening condition. The mother has a medical condition that's making her pregnancy high risk. And so the doctors are saying this is a medically necessary abortion. What is your take? Are there medically necessary abortions?
There is no such thing as a medically necessary abortion, ever. The reason I say that is because there are specific physicians who have done additional training on top of just being a general OBGYN. Those are called maternal fetal medicine doctors or perinatologists. Their job is to deal with all of the high-risk pregnancies. So when a mom has a high-risk pregnancy, any cardiac defects, issues with their thyroid that are severe, issues with kidneys, whatever it may be, diabetes, those doctors are the ones that monitor those pregnancies very closely in conjunction with the OBGYN and give advice. They do more ultrasounds for this patient. They do more monitoring for this patient. And they evaluate week to week, can this pregnancy continue safely? Is the mother's life at risk at this point, at this point, at this point? And they have the ability to try and get those pregnancies as far along in the pregnancy as possible prior to delivering. And there's a difference between delivering a baby early, if the mother's life is truly at risk, versus injecting the baby with medication that's going to kill the child and then forcing the mother to deliver vaginally a dead child, or dismembering the baby while the baby is inside of the mother. That is an abortion. What I would advocate for is allowing that baby to live as long as possible. If the time comes, even if the baby is pre-viable and can't survive on its own, delivering the baby in such a way that the mother gets the chance to hold their child, bury their child, mourn their child, rather than their child ending up in the trash can. If you do that, then you're giving dignity and honor to that family and to that child. If you don't do that, then you're just telling the mom that because she has a child with trisomy 18 and that child is going to have a different quality of life or a different type of life than you and I might have, that their life is not worthwhile and that she shouldn't have that baby because the child has Down syndrome. In my experience, people that have differing abilities are probably the greatest gift that we have on our planet.
Wow.
They are the ones with all the love and all the joy. We have so much to learn from them. And you can't tell me that just because somebody has trisomy 18, that they're definitely going to die at this point and they don't deserve a shot at life. I mean, Senator Santorum has a child who has trisomy 18. Yes, they've gone through lots of medical challenges, but his children write books about how his daughter has impacted their life and what a joy she has been and how she helps them to understand that every day is precious. Yes, there are babies that die early with that, but there's also miracles.
Dr. Ruberu, what about early delivery preterm? So when the baby is pre-viability and there's, let's say in that monitoring situation, there's a lot of monitoring, and then let's say, and you tell me if this is a case that you think could be a real case. I've heard people say, oh, I had to have an abortion, again, that language, because the baby was pre-viability and I had this life-threatening condition. What is your take on that?
So it really depends on the condition, right? So say somebody has a cardiac defect and they can't, deliver vaginally. Well, they could probably have a C-section delivery and still be able to, take care of the baby.
Post-viability. Give the baby a shot.
Even pre-viability, even if that baby, I have a patient who Their baby had anencephaly. So a part of the skull was missing, a part of the brain was missing. And they knew that their child would not be able to survive outside of the womb. But they made the decision that every moment that that child was alive, they were going to love on that child and create memories with that child. And at the time of delivery, they were told that because of the way the baby was lying, because of the way the baby, it wouldn't be a safe delivery, that they couldn't get the baby out vaginally, that it would be too difficult. So she opted for a C-section, even though she knew that her baby was not going to survive. And she does not regret it. The ability to hold her baby in its last few moments while it was breathing, the ability to mourn that child and have a funeral for that child means the world to her. And there are so many others that they're not really being given that sort of a story to look at as an option. They're just being told, you know, for instance, your water has broken, you're 18 weeks along, your baby is not going to die, your baby is going to be born with all these contractures and problems breathing, and it's just a suffering for that child, and so you should instead terminate it. Acting like termination or an abortion is the kind and loving thing to do rather than the barbaric thing to do. Pulling a child apart piece by piece is definitely not kind and loving. There's no kindness or lovingness associated with that in reality. But I have a patient who her water did break at 18 weeks. And somebody did come in the room and tell her that she should have an abortion. And she told that person never to come back into the room, that she never wanted to see their face again. And she decided to just stay in that place, have the SCDs on her legs so that she was trying to prevent blood clots, wouldn't let anybody examine her, watched for signs of infection every day. And by the grace of God, she managed to make it all the way to 26 weeks.
Wow.
And that baby's cord dropped and she ended up having a stat C-section. They delivered the baby and he did phenomenally well.
Wow.
So there are...
What's so heartbreaking about, I mean, thank God, that beautiful little life. I mean, I'm sure like he'll be 18 years old and say, wow, my whole life is because my mother fought for me.
Yes.
There are so many mothers, and I know some personally, who they were told that fear-mongering, you are going to die here at 18 weeks, 17 weeks, 16 weeks. If you continue the pregnancy, we need to do an emergency abortion. And they're told, oh, it's not even an abortion because it's an emergency situation. But it usually involves that immediate delivery, letting the baby die, or sometimes horribly live dismemberment. And they're not even really told that as a mother. They don't understand. And if they had had better treatment.
Yes. Yeah.
Now, it's not always a success story.
It's not, because sometimes women, when their water breaks, they do develop infections. And that is obviously not what we want. But in that case, that is the indication for delivery. But even in that case, that's not an abortion. That is, now your baby is in a bad environment and now your life truly is at risk. So let's give you some medication to start stimulating contractions so you can deliver this baby naturally. And then we can get all the infection out of you. And then you have the opportunity to hold your child and mourn your child and everything else. There isn't a hospital in the world, at least when I was doing my training, when I was in residency and I was in the hospital before my privileges were taken away because I refused the COVID vaccine.
Oh my gosh, that's another story for another time.
But there wasn't a single time that any woman who was in the hospital pregnant exhibited signs of what we call chorioamnionitis, an infection in the womb, that wouldn't be delivered instantly. Like that process would normally be started. And it doesn't matter if you have a law about heartbeat bills or anything else. That is a true medical emergency where an induction is allowed, even in like religiously based hospitals that don't do abortions. That was allowed. And so,
and the difference there is you're not targeting the baby's body destruction. The baby's in the hostile environment. The mother's life is at risk immediately, imminently. And so there's an early delivery, which you hope there was medical technology to keep that baby alive. And sometimes tragically there isn't. But you still give the baby the dignity of being mourned and loved for as long as that baby can live.
Absolutely.
All right, I know we've got to wrap here, but what is your message to doctors? What is your message to doctors and aspiring medical professionals to be truly, not just truly pro-life, but pro-human being,
Yeah.
pro-woman?
Number one, I would say, is look at every patient as an absolute gift and an absolute mystery. Don't allow yourself to get into a position where you are being employed and you're being told that you only have like 3 minutes to spend with each patient, because that is not a way to practice medicine. You need to find an environment where you can actually minister to these patients, where you can listen to them, talk to them, understand what's going on in their lives and in their health, and actually address the underlying issues. Don't be comfortable to cover up symptoms with Band-Aids. Actually use your medical knowledge to help them understand the root cause and give them good advice. And don't be afraid, because I think most of the decisions that when I was in residency, they would drill it into our heads. If you step outside of this box, you're going to get sued. And then you're not going to be able to practice medicine. What I would say is, if you practice good medicine and you have good relationships with your patients, then they will value your advice and they will want to come to you and get your advice, and you can help a lot of people. Don't allow somebody else to box you in and prevent you from practicing good medicine.
Thank you so much, Dr. Ruberu. This is awesome, and I'm so grateful for you and the example you are to so many people. I know it's an encouragement to so many people. Thank you.
You.